Hey everyone, so today now we'll be starting with part 3 anesthesia. So starting with Mallampati score, we have 0, 1, 2, 3 and 4. So in 0, entire epiglottis is seen, and in 1, complete uvula is seen. Then tip of uvula, base of uvula and soft pellet will not be seen. So these are 5 grades of the Mallampati score. Then coming to risk factors, so you can remember it as obese neck. So obese, B for bearded, E for edentalus, S for snorer, E for elderly, and neck. It has to have greater than 40 centimeter circumference. And also other points you have to check are finger, 3 finger breadth has to be there, and thyromental distance should be greater than 6.5 centimeter, and sternomental distance should be greater than or equal to 13 centimeters, and lip bite test has to be positive. So these are the criteria. Now coming to another classification, that is Cormack-Lehane intubation, laryngoscopy basically, not intubation exactly. So Cormack-Lehane laryngoscopy grading. So we have grade 1, 2, 3 and 4. So in first one we can see vocal cords, posterior commission and epiglottis. In second one we can only see posterior commissure and epiglottis. Third one only epiglottis, and fourth one we can't see anything. And coming to next part, that is difficult intubation. So plan A, plan B, plan C and plan D. So in plan A is face mask ventilation, 3+1 attempts. So these are max attempts that can be used. Face mask ventilation plus intubation. Also we will use direct or video laryngoscopy assistance. Here we will give pre-oxygenation also, 3-minute 100%. Then coming to plan B, we can use second gen LMA. Max attempts is 3. In this plan C we will be using only face mask ventilation. Indeed there is restriction of mouth opening, so we will be using fauna, front of neck axis or scalpel cricothyroid. So these things can be used. Also risk factors of Mallampati, they can be seen by fiber optic intubation. Next we will be starting with some more instruments. like central line, Swan's catheter, chemo port, tunnel catheter. So starting with central catheter. Okay, now central catheter. So most common investigation of choice to confirm this will be chest X-ray, and we'll be doing it as SVC at the rate RA junction. So subclavian vein will be the most commonly used vein, and we'll be using 7FR, which means French. Now infection that is commonly seen is epidermidis, S epidermidis, or cons. So this is about central catheter. Now we have some more points to remember. So most common vein for central line is internal jugular vein. However, most common vein for total parenteral nutrition will be subclavian vein. Max risk of pneumothorax is of subclavian vein again. We have max risk of thrombosis and infection with femoral vein. So these are few points you have to remember. Now coming to next one, that is Swan's catheter. We have 4 ports here. So one port is thermistor. It is used to measure the core body temperature, and ideal site will be pulmonary artery. So as a result, we'll get pulmonary capillary wedge pressure, and we can indirectly measure left atrial pressure also. So most commonly, the lower end of esophagus is used to insert this. So this is about Swan-Ganz catheter. Now coming to chemo port, it is subcutaneously present, and it is also called as port cath. It is used for chemotherapy. Coming to tunnel catheter, so here we have Dacron cuff, which will undergo fibrosis, and this is the property that is used for several purposes. It is also present subcutaneously. Now it is used in dialysis, for total parenteral nutrition, for chemotherapy, and permacath and Hickman's catheter. So they are used for long-term IV uses and all. So these are for long-term management. Now coming to next part, that is total parenteral nutrition. So total parenteral nutrition will be giving it in ratio of 20:30:50. So this is protein, this is fat, and this is, so carbs will be more than fat and then protein. Now coming to next thing, so if there is 1 kg per day weight gain, it is due to fluid overload, and weight gain after 6 days has to be checked. Refeeding syndrome. Refeeding syndrome is caused due to hypopotassium, phosphorus, and magnesium. So it can be because of either one of these. Now, deficiency commonly seen will be zinc and B12 deficiencies, and most common metabolic complication is insulin resistance. Insulin resistance. Okay, so this is about part 4, and next we'll be meeting again in part 5.